My name is Marie Conley, and thank you for being here today to recognize Rare Disease Day Advocacy and Awareness in Pennsylvania. While everyone else across the country recognized Rare Disease Day on or around February 28th, we in Pennsylvania decided it was too cold in February, so we postponed our original date that was set in March because of a so-called blizzard, so that we could reschedule it for today when it's nice. Before we begin, please help me recognize a few of our legislators who are with us, and we will have many coming by back and forth, but Representative Marcy Toepel and Representative Mark Longgetti. Last March, I had the honor to serve as MC, and I'm proud to do so again today. My name is Marie, and in 2012, I was diagnosed with a rare disease called Cushing's disease. After 3 years or more and more than 7 specialists, I was finally diagnosed at the University of Pennsylvania with Cushing's disease. Between 2 and 10 people per million are diagnosed each year. I had a brain surgery, my adrenals removed, my lower right lobe of my lung resected, more than 26 visits to the ER, and several night stays since then. Not uncommon for those of us with rare diseases, I'm battling yet another medical issue for the past 18 months that has me under the care of my endocrinologist, a neuroendocrinologist, a reproductive endocrinologist, who are all trying to figure out what the heck is going on with my body and trying to help me fight back. Not unlike any of us here living with a rare disease, it is nearly impossible to get a quick fix for what is wrong with us. We know how very isolating and alone it is to have a rare disease. Most people even can't pronounce our diseases, and often we do not look sick from the outside, but every minute our insides remind us that we are. As a patient, I am grateful for our host, for the National Organization of Rare Disorders, and you'll hear that referred to as NORD, and Life Sciences PA for their advocacy to support patients like me and families and caregivers. Many of us stood here last year so excited about the creation of a bipartisan rare disease caucus. I'm not sure about any caucuses, but I can tell you this group has made some tremendous steps over the past year. On May 10th, rare disease patients across Pennsylvania had more than hundreds of advocates voice their support for us as they unanimously passed House Bill 239, which would go to create the first Pennsylvania Rare Disease Council. On behalf of all of us, it is my honor to introduce Representative Marcy Toepel, who has sponsored this bill. Representative?
Thank you and good morning. As co-chair of the Rare Disease Caucus, it is my pleasure to stand here with the rare disease community and recognize today, March 24th, as Rare Disease Day in Pennsylvania. Who makes up the rare disease community? It's our friends, neighbors, brothers, sisters, parents, and children, our coworkers, colleagues, Sunday school teachers, coaches, and doctors. Rare disease touches all of us. Excuse me. In fact, 30 million Americans have a rare disease. That's 1 in 10. 2/3 of those people are children. With more than 7,000 rare diseases, the challenges to find a treatment protocol and cures are great. Even correctly diagnosing a rare disease can take years, precious years spent going from doctor to doctor without treatment. I first got involved in this issue after meeting with a constituent, Joe Coyne, who came to see me about his son Garrett, who was diagnosed with Batten disease. Garrett has been courageously fighting this disease that currently has no cure. His family has held countless fundraisers and raised hundreds of thousands of dollars to invest in research in this extremely rare genetic disorder. Situations like his are hard to hear, but necessary in understanding the challenges that these families face. Ordinary activities become extraordinary balancing acts for families while attempting to keep some semblance of normalcy, especially for their children. These stories, a maze of challenges faced by those with a rare disease, led me to introduce House Bill 239, which would create a Rare Disease Advisory Council. I want to thank Representative Longgetti as well at this point, because he is a co-chair of the Rare Disease Council. He's been a champion of this bill as well and was a co-sponsor of the bill. So thank you, Representative Longgetti. This council would include patients, doctors, hospitals, state agencies, parents of children with a rare disease, the educational community, researchers, and the insurance industry. They would be tasked with looking at best practices across the nation and consequently make recommendations regarding the best and most efficient ways to provide and coordinate services to the rare disease community. This important bill received unanimous support both when it went before the Health Committee and the full House for a vote. Now it is being considered by the Health and Human Services Committee in the Senate. I want to thank NORD and the Pennsylvania Life Sciences for their work on this bill. Without their assistance, the bill would not have been drafted. I hope the Senate votes on this bill in the near future. In this instance, time is not on our side. We need to work together to find better ways to assist those who get up each day and find a new battle is awaiting them. Let's do what we can to help in that battle. Thank you.
Thank you, Representative Toepel, for your leadership and for being our voice. And thank you, Representative Longgetti. The NIH defines rare diseases as a disease that's prevalence is fewer than 200,000 individuals. There are more than 7,000 rare diseases and only approximately 450 FDA-approved medical treatments. Most medical researchers are not studying these diseases. Often research gets funded by families and friends of patients and patient organizations. Our next speaker has spent over 25 years working with patients and teaching medical students. He has also spent much of that time involved in medical research. Most of his work was dedicated to patients with rare diseases. Dr. Marcus Carr took his passions, energy, and knowledge of rare diseases to the private sector, where he is head of clinical development at Spark Therapeutics. Research and new knowledge is literally, more often than not, the lifeline for rare disease patients. Ladies and gentlemen, Dr. Marcus Carr.
Well, thank you very much for that kind introduction, and thanks to the state legislature for the opportunity to be here today at this gathering of rare disease advocates. Whether you're living with a rare disease, a caregiver of a person with a rare disease, a legislator or a researcher like myself, what we're doing here today is very important. It is critical to advancing the next generation of therapies for rare disease. As you've already heard several times, a rare disease is defined in the United States as having less than 200,000 people affected. There's other places have other definitions, but they're quite similar. What is clear, however, is that people with rare disease are deserving of therapies, access to proper diagnosis, and support as adequate as is given to patients with larger diseases such as heart disease, diabetes, and breast cancer. And as you also know, having a rare disease can be more challenging than having a common disease. This is true for several reasons. First, the clinical diagnostic pathway is not clear in many cases. And so it can take several years or many years to even get a diagnosis. And once you have the diagnosis, you may not have an adequate therapy. In fact, in many cases, therapies are non-existent. That's why raising awareness for each and every rare disease and convening the community is so important to raise awareness and advance research. This research will ultimately lead to more effective therapies and treatments. Many rare diseases, and particularly those that we're concentrating on at Spark Therapeutics, are caused by underlying genetic mutations. A mutation in one or two genes is enough to be responsible for a disease in many cases. The sequencing of the human genome, it was hoped, would allow us to turn genes into medicine. However, this has proven much more difficult than anyone anticipated. At Spark Therapeutics, our approach is to address the disease at its core. by addressing the mutated gene. We can augment the function of a poorly performing gene, we can suppress the function of a gene, making a bad product, or we can simply replace the gene. Once the body has a genetic material, it should be able to produce the required protein or stop producing a harmful protein, and in so doing, we can restore proper functioning to disease cells and therefore slow the progression of disease. A primary challenge of gene therapy is making sure we get the genetic material to the cells that need it the most, and making sure we do that in a way that avoids the immune response of the normal body. The body might recognize the genetic material as abnormal or foreign, and therefore remove it and therefore blunt the effect of gene therapy. I want to share just a few statistics with you about gene therapy, some of which may be a little bit surprising. Gene therapy research has been ongoing for 40 years. And during that period of time, up to 2016, 2,300 clinical trials have been started, approved, or finished. Even with all those years of hard work, all those man hours, all those resources, all those clinical trials, at this point, we do not have a single gene therapy approved for a genetic disease in the United States. The potential impact of gene therapy is the prime motivation for people like me, and I'm sure for people like you. It's been, to make such an advance of such a magnitude requires time. There's setbacks and adversity, but it's ultimately a game of persistence, and we will be persistent. The potential rewards for patients are now in sight. There are now 20 gene therapy trials in phase 3. That's the end of a long, long process that allows you to take the regulatory authorities for approval. I'm proud that at Spark, we are at the forefront of this exciting field, and I can tell you that last Tuesday, we completed our first filing of a biological license application in the United States for an inherited retinal disease caused by RPE65, a disease that causes blindness in children. Hopefully, that will be approved, and hopefully we'll launch a treatment for that disease next year. At Spark, patients are our guiding force. We recognize their essential input, and collaborating with patients and patient advocacy groups around the world allows us the interactions to gain valuable insight into patient experience. Several of our employees, as was mentioned, are practicing physicians, and many have seen the first-hand effects of debilitating diseases like retinal diseases, neurological disorders, and hemophilia. I have treated hemophilia for 25 years. And I hope to see the day when it is cured. The day when it's so long between bleeds that the patient forgets how bad it really is. It is the resilience of these people that serve as our inspiration to push through the barriers and create a world where no life is limited by genetic disease. We need your continued support, and with that, Spark Therapeutics and other companies committed to innovative therapies are indeed striving to make genes into medicines. And I'm happy to say we're getting closer every day. Thank you.
Thank you, Dr. Carr. As you heard, collaboration is the key for all rare diseases. Patients, advocates, doctors, nurses, RNs, PAs, researchers, pharmaceutical companies all play a key role in finding a cure. Once it becomes law, the creation of the PA Rare Disease Council will provide a voice for an estimated 1.2 million people in Pennsylvania. 2/3 of those are children. The only question that mattered when I was diagnosed was this disease hereditary? I thank God every day that it is not. I won't even begin to try to articulate what a parent must go through when a child has a rare disease. These parents and caregivers are angels, and they're here today, and they deserve a round of applause. Unfortunately, Kristen Smedley, a parent advocate and president of and co-founder of Curing Retinal Blindness Foundation, was going to speak about her family's journey and the importance of advocacy, research, and awareness, but she was suddenly not unable to attend this morning. Her two sons, Michael and Mitchell, are affected with CRB1 LCA, a rare disease that causes blindness. Our next speaker is one of the almost 1.1 million Pennsylvania children that I referred to earlier. I've known her since she was a little peanut in her mom's belly because her dad was my very first friend, or boss as he likes to think, in Harrisburg. Michael and Lisa Wolf have been part of my family ever since. I've watched her grow into a beautiful, strong young woman. She is caring, talented, an amazing baker, a dog whisperer. She is a daughter, a sister, a granddaughter, a friend, and she is suffering. Carly Wolf has Ehlers-Danlos syndrome, a genetic condition that causes her body to produce faulty collagen, creating a multi-system dysfunction. She also has POTS, a co-condition of EDS that causes a rapid heart rate, blood pooling in her extremities, fatigue, dizziness, headaches, and MCAS, which is a mast cell activation syndrome. Because of these conditions affect multiple systems, patients like Carly are often misdiagnosed and suffer for years before a doctor can accurately diagnose and treat the many different symptoms associated with these conditions. It's now my honor and pleasure to introduce Carly Wolf.
When you look at me, what's the first thing that you think of? Most likely, not that I have a rare disease. Well, you aren't alone. That happens to me all the time. I get the comments like, well, you don't look sick, or you look great, a lot. But the truth is, I have two invisible illnesses called Ehlers-Danlos syndrome and mast cell activation disorder. Ehlers-Danlos is a collection of inherited connective tissue disorders, and mast cell is a condition in which mast cells inappropriately and excessively release histamine. Both conditions impact multiple systems, including the brain, digestive system, heart, and joints. Even though you can't see my illnesses, one thing that people do see is my smile. I am rarely seen without one. People are always commenting me on how strong I am, but here is the matter of fact. My illness has shaped my life, but it isn't my life. A smile for me can hide so much. I work hard to have a great positive attitude, and that's what gets me through my illnesses. There are many challenges to an invisible illness. One of them obviously being that they are invisible to most everyone but me. There are some days when I cannot get out of bed because of a migraine or that my joints hurt so badly. But the days that I get out of bed, that does not mean I have no symptoms. I joked around with my brother one day and said, if I stayed in bed every day that I didn't feel good, I would rarely leave my bed. The other challenge is when people cannot see your illnesses, they often dismiss it, or even in some cases think that you're making it up. I sadly had some friends that thought that. Most invisible illnesses are hard to explain, and honestly, I don't want to spend all my time talking about what's wrong with me, except when I'm talking to my doctors. Then I often wish they would listen and want to talk a little bit more. EDS and mast cell are hard to diagnose and even harder to treat because everyone's symptoms are so individual. Many of the symptoms sound like other things, and so doctors either misdiagnose the patient or the patient goes untreated. I've read many stories and talked to other people who have gone years without a diagnosis. A lot of times, they've been told that there's nothing wrong with them or that they have anxiety. Or in the case of EDS, they've been brushed off as growing pains. All of these things can severely impact the patient's well-being. A complicated and rare disease is bad enough without the support of a trusted and knowledgeable healthcare provider. One of the main goals for Rare Disease Day is awareness. Awareness is an important part of any disease, let alone one that is rare. Let's take this statistic for example. 95% of rare diseases have not one single FDA-approved drug treatment. With more awareness comes funding, and with funding comes research. We can have hope for a future if we keep on with our events. I would like to say a big thank you to the organizers of this event, but also I would like to say a thank you to Miss Marie. Besides being a close friend of my parents and a great support to my mom, she has been an inspiration to me. She makes me laugh and more than anything understands the daily challenges of those with rare diseases face. And thank you all for being here. We need to continue our efforts to raise awareness for rare diseases and to provide support to those who are suffering, and to make sure that doctors have information and resources to help their patients. Your being here gives us all hope that cures can be found and lives can be changed. Thank you.
Thanks, Carly. I'll deal with you later. Henry Ford once said, "Coming together is a beginning, keeping together is a progress, working together is success." As rare disease families, we often feel alone, but our next speaker and the group that she represents allows us to know we're not. Nor does a patient advocacy organization dedicated to individuals with rare diseases and organizations that serve them, and is the official sponsor for Rare Disease Day. Please help me welcome Melanie Swick, Advocacy Assistant at NORD.
If you would all oblige me, I'd actually like to give another round of applause for all of our speakers today and our wonderful MC. They've been amazing. So good morning. As she said, my name is Melanie Swick, and I'm with the National Organization for Rare Disorders. Before moving to DC, I actually lived in Lancaster for quite a bit. It's where my husband grew up, so I'm very happy to be here today, and on behalf of NORD, speak at Pennsylvania's Rare Disease Day. To start us off, I have a few thank yous. First, this wonderful event was truly made possible by the efforts of the Friedreich's Ataxia Research Alliance and the Planning Committee members. In particular, I want to say thank you to our state leaders, Kyle Bryant and Ann Mushino, for their hard work and dedication. NORD is so grateful for all that you do. Second, I would like to thank those advocates here in the Pennsylvania legislature, such as Representative Marcy Toepel, for fighting daily so that rare disease patients have a voice in government. Finally, I would like to thank all of you that are here in the audience today. We so appreciate you coming out and giving attention to something as important as rare diseases. Rare Disease Day was created to bring people together and shine a light on rare diseases. The very nature of a rare disease can make those who are diagnosed feel terribly alone. But with 30 million Americans living in the United States with a rare disease, they are anything but. Alone we are rare, together we are strong. It is on this day that we take time to acknowledge, celebrate, and support the rare disease community, whether that's telling a story, listening to a story, donating, advocating for policies that benefit the rare disease community, or learning about the more than 7,000 known rare diseases. Consequently, I feel that it is most appropriate today to speak about something else that aims to raise up those with rare diseases, and that is the Rare Disease Advisory Council. Thanks to the work of lead sponsor, Representative Marcy Toepel, and her colleagues in the Pennsylvania House, and passionate individuals such as Craig Tucker, HB 239, a bill to establish a Rare Disease Advisory Council, has passed the House and is headed to the Senate. I cannot overstate the importance of this legislation. Rare disease advisory councils enable the voice of rare disease patients to be included by making recommendations to the state on issues related to healthcare access and coverage for rare disease patients. Despite the significant number of Americans that are impacted by rare diseases, it is often the case that their unique experiences are overlooked when crafting healthcare policy. No longer. We look forward to working with the Senate on getting this legislation to Governor Wolf, for if we are successful, the voices of those that are intimately involved with rare diseases will be heard. If you would like to work with us too, then I highly encourage you to join our Pennsylvania Rare Action Network today and make a difference. The Rare Action Network, powered by NORD, serves to connect and empower a unified network of individuals and organizations with tools, training, and resources to become effective advocates for rare diseases through national and state-based initiatives across the United States. Rare Action members are able to do this through policy, awareness, and educational events within their communities here in Pennsylvania and across the U.S. To sign up, please visit rareaction.org. Together, we are strong. And together, we can ensure that the voice of the rare disease community is heard in Pennsylvania. Thank you.
I just want to thank again Melanie and Craig Tucker and Bon Allen and Ann and Bryant and Kyle for everything that you have done to move Pennsylvania forward as a leader in rare diseases. We'd also like to thank our sponsors, Connects Healthcare, CSL Behring, Pfizer, Sanofi, Shire, and Spark Therapeutics. On behalf of all of the rare patients here today and across Pennsylvania, thank you for listening to us and for continuing to advocate for us. I read a great blog on NORD a while back about the power of words from Elaine Tobin. She quoted Shel Silverstein. She had blue skin, and so did he. He kept it hid, and so did she. They searched for blue their whole life through. They passed right by and never knew. Through the great work of NORD and people like Representative Toepel and Representative Longgetti and all of our legislators, we hope that House Bill 239 will create a network for Pennsylvania rare disease patients and will hopefully provide us some opportunities so we'll never have to pass by each other. Thank you again to all of our speakers, and we look forward to seeing you next year.